If your doctor has been unable to resolve your or your loved one's condition, please leave us a comment with a brief description. We will get back to you with current research information. Ear infection. Ear infections are the most common reason parents bring their child to a doctor. 3 out of 4 children will have at least one ear infection by their 3rd birthday. Adults can also get ear infections, but they are less common. My ear hurts. If your child isn't old enough to say, "My ear hurts," here are a few things to look for. Tugging at ears. Crying more than usual. Fluid draining from the ear. Trouble sleeping. Balance difficulties. And hearing problems. The infection usually affects the middle ear and is called otitis media. The tubes inside the ears become clogged with fluid and mucus. This can affect hearing, because sound cannot get through all that fluid. Your healthcare provider will diagnose an ear infection by looking inside the ear with an instrument called an otoscope. Often, ear infections go away on their own. Your healthcare provider may recommend pain relievers. Severe infections and infections in young babies may require antibiotics. Children that get ear infections often may need surgery to place small tubes inside their ears. The tubes relieve pressure in the ears so that the child can hear again. Causes of an ear infection. An ear infection is caused by a bacterium or virus in the middle ear. This infection often results from another illness such as a cold, flu, or allergy that causes congestion and swelling of the nasal passages, throat, and eustachian tubes. Role of the eustachian tubes. The eustachian tubes are a pair of narrow tubes that run from each middle ear to high in the back of the throat, behind the nasal passages. The throat end of the tubes open and close in order to regulate air pressure in the middle ear, refresh air in the ear, and drain normal secretions from the middle ear. Swollen eustachian tubes can become blocked, causing fluids to build up in the middle ear. This fluid can become infected and cause the symptoms of an ear infection. In children, the eustachian tubes are narrower and more horizontal, which makes them more difficult to drain and more likely to get clogged. Role of adenoids. Adenoids are 2 small pads of tissues high in the back of the nose, believed to play a role in immune system activity. Because adenoids are near the opening of the eustachian tubes, swelling of the adenoids may block the tubes. This can lead to middle ear infection. Swelling and irritation of adenoids is more likely to play a role in ear infections in children because children have relatively larger adenoids compared to adults. Related conditions. Conditions of the middle ear that may be related to an ear infection or result in similar middle ear problems include otitis media with effusion, or swelling and fluid buildup, which is called effusion in the middle ear without bacterial or viral infection. This may occur because the fluid buildup persists after an ear infection has gotten better. It may also occur because of some dysfunction or non-infectious blockage of the eustachian tubes. Chronic otitis media with effusion occurs when fluid remains in the middle ear and continues to return without bacterial or viral infection. This makes children susceptible to new ear infections and may affect hearing. Or chronic suppurative otitis media, an ear infection that doesn't go away with the usual treatments. This can lead to a hole in the eardrum. Risk factors. Risk factors for ear infections include age. Children between the ages of 6 months and 2 years are more susceptible to ear infections because of the size and shape of their eustachian tubes and because their immune systems are still developing. Group child care. Children cared for in group settings are more likely to get colds and ear infections than are children who stay home. The children in group settings are exposed to more infections, such as the common cold. Infant feeding. Babies who drink from a bottle, especially while lying down, tend to have more ear infections than do babies who are breastfed. Seasonal factors. Ear infections are most common during the fall and winter. People with seasonal allergies may have a greater risk of ear infections when pollen counts are high. Poor air quality. Exposure to tobacco smoke or high levels of air pollution can increase the risk of ear infections. Alaska Native heritage. Ear infections are more common among Alaska Natives. And cleft palate. Differences in the bone structure and muscles in children who have cleft palates may make it more difficult for the eustachian tube to drain. Complications. Most ear infections don't cause long-term complications. Ear infections that happen again and again can lead to serious complications such as impaired hearing. Mild hearing loss that comes and goes is fairly common with an ear infection, but it usually gets better after the infection clears. Ear infections that happen again and again, or fluid in the middle ear, may lead to more significant hearing loss. If there is some permanent damage to the eardrum or other middle ear structures, permanent hearing loss may occur. Speech or developmental delays. If hearing is temporarily or permanently impaired in infants and toddlers, they may experience delays in speech, social, and developmental skills. Spread of infection. Untreated infections or infections that don't respond well to treatment can spread to nearby tissues. Infection of the mastoid, the bony protrusion behind the ear, is called mastoiditis. This infection can result in damage to the bone and the formation of pus-filled cysts. Rarely, serious middle ear infections spread to other tissues in the skull, including the brain or the membranes surrounding the brain, which is called meningitis. And tearing of the eardrum. Most eardrum tears heal within 72 hours. In some cases, surgical repair is needed. Prevention. The following tips may reduce the risk of developing ear infections. Prevent common colds and other illnesses. Teach your children to wash their hands frequently and thoroughly and to not share eating and drinking utensils. Teach your children to cough or sneeze into their elbow. If possible, limit the time your child spends in group childcare. A childcare setting with fewer children may help. Try to keep your child home from childcare or school when ill. Avoid secondhand smoke. Make sure that no one smokes in your home. Away from home, stay in smoke-free environments. Breastfeed your baby. If possible, breastfeed your baby for at least 6 months. Breast milk contains antibodies that may offer protection from ear infections. If you bottle feed, hold your baby in an upright position. Avoid propping a bottle in your baby's mouth while he or she is lying down. Don't put bottles in the crib with your baby. And talk to your doctor about vaccinations. Ask your doctor about what vaccinations are appropriate for your child. Seasonal flu shots, pneumococcal and other bacterial vaccines may help prevent ear infections. We hope you have found this information valuable. If you enjoy these videos and want to support us being able to continue creating content for many years to come, we'd love for you to consider becoming a patron of Converged Medical Research. The link for becoming a patron is in the description below. We have many other sessions on medical-related topics coming. If you need information on a particular topic, please leave a comment below. Please click the subscribe button and ring the bell.